Right. Good afternoon, everyone. So welcome back to another Generali Philippines webinar. I am John Ketty, your host for this afternoon from Generali Philippines. All right. So now Philippines is in its 8th month of rolling out its COVID-19 vaccination program. And as of today, at least 24 million Filipinos, or at least 22% of the population, have received their full COVID-19 vaccine. The Philippine government and private companies continue to roll out the COVID-19, I'm sorry, vaccination nationwide, and now a pilot one for COVID-19 vaccination in minors between the ages 12 to 17 was conducted early this October in various hospitals in Metro Manila. Last October 22nd, phase 2 of the vaccination for minors has officially started in different cities in Metro Manila, prioritizing those minors with comorbidities. Now, a nationwide rollout of COVID-19 vaccination in minors is set to be scheduled today, November the 5th. And just recently, a COVID-19 Delta subvariant, its AY.4.2, has been newly discovered and believed to be more contagious than the Delta variant. The Philippines Health Technology Assessment Council, or HTAC, has released its recommendation on COVID-19 booster dose to health workers this fourth quarter of 2021. Priority groups in vaccination may be qualified to receive the booster shot by 2022. Now, questions on safety still remains. Are the available COVID-19 vaccines safe to be administered to minors? And if the COVID-19 initial and booster doses can protect us against the emerging variants. But this afternoon, we are privileged to have with us an infectious disease specialist to keep us updated on the COVID-19 and ways to protect ourselves and loved ones against it. This webinar is in cooperation with Home Healthcare, our premium provider of health and wellness programs. Now, just a few reminders before we start our program. We will put everybody on mute so that you can hear our speaker clearly during her talking segment. Now, if you want to engage with us, just send us a message through the chat box below your screen. Feel free to write down your questions to our speaker, and the live Q&A box is open throughout the talk. You can type your listed questions there, and we will do our best to answer it during the Q&A segment. And so, without further ado, let's begin our program. Our speaker for today is a graduate of medicine from the University of the Philippines. She obtained her fellowship on infectious and tropical disease in pediatrics in UP, Philippine General Hospital. She also served as an associate editor in Philippine Journal of Pediatrics, and she is a former co-chair of Ways and Means Committee of the Philippine Pediatric Society Annual Convention, and the chair of Committee on Handbook of Pediatric Infectious Disease. Currently, she is a professor and chief of the Division of Infectious and Tropical Disease in Pediatrics in the College of Medicine at Philippine General Hospital, University of the Philippines, Manila. Welcoming to our screen, Dr. Annalisa Ong Lim. Glad to have you with us this afternoon, Doctor.
Hi, good afternoon, and good afternoon, everybody. Thanks for the kind invitation to join you this afternoon and have an opportunity to share a little bit about what's happening now, where we're headed in terms of COVID-19. So let me just get my slides started. There. Is that showing up? Let me just verify. Are you seeing the slides?
Yes, you can say it, Doctor.
Okay, great. So what I'd like to do for the rest of this session is really just walk us through 3 simple questions that I feel will help us understand the current situation better. So first is, where are we now? And then talk about how we got here in the first place. And then how do we move forward? So in the introduction, the current numbers were actually shared already. And at the moment, we are nearing 2.8 million total cases that have been reported from the country since the time that COVID-19 started to be tracked in March of last year. I think what's remarkable to understand here is that um, the almost 800,000 cases, or rather, the 2 million case was actually registered at the start of September. And so if you will look at the current numbers, the almost 800,000 cases that have been registered since then were actually detected in less than 2 months' time, or just a little bit over 2 months' time. And so I think this is really an illustration of how quickly cases can really multiply if we don't keep our guards up. And you will see also from this graph, how steep the rise was. And what's quite reassuring is the fact that the solid line is not only on its way down, but also we are seeing that the individual bars, which represent the weekly reports, are below the 4-week moving average that is represented by the solid line. So this is indicating that we will probably continue to see a downward trend barring any other unusual events that might happen in the next couple of weeks. Of course, that almost 2.8 million cases are not all active. In fact, the majority of them can be classified as recovered. But what I'd also like to show is the number of active cases that we have at the moment, which is about 38,000. This is already a significant improvement compared to the numbers of 2 or 3 weeks ago, where clearly there were reports of the healthcare system being so overwhelmed that people were actually being refused admission in hospitals, or we even saw pictures of people receiving healthcare while parked in their cars. So very disheartening, very anxiety provoking, but we're quite blessed to be able to say that we're over that hump for the moment. It's also important to understand the breakdown of severity of diseases that are being reported into our system. As a general rule, most cases of COVID are actually classified as asymptomatic or mild. And typically, the breakdown was 80, 15, and 5%, with 80% being in the asymptomatic or mild category, moderate cases numbering about 15%, and severe and critical disease classified, or rather making up about the 5% balance. Of course, this will really depend on testing strategies being employed in a country. And what we have right now, I should say, is a little unusual because the numbers are skewed a bit. Here we see that we only have about 75% of our asymptomatic and mild cases being reported, while the severe and critical make up a slightly higher number than usual at 11 to almost 12%. So I think we have to understand also that the behavior that might be driving these numbers. I'm sure many of us know of our friends or even family members who have opted not to be tested, and who may either have just utilized antigen tests for diagnosis, or have decided to just isolate at home or quarantine at home rather than be tested with a PCR. And because of that, this might be a reason why what we're seeing being classified or being reported are actually more of the moderate, severe, and critical, because they are the ones who will definitely be tested because they need to access healthcare. It's also important to understand what's happening in terms of healthcare utilization. The country has about 1,300 hospitals, no, scattered nationwide. And during the surge, the utilization was pushing almost 80% and was very near the critical levels. With the decrease in the number of cases, we see that occupancy is quite respectable now at about 30%, with only 14% of all facilities being classified as at risk, with either moderate, high risk, or critical occupancy. The ICU beds, though, are still quite full at 40%. And we have to understand that even as the numbers are going down, it will take anywhere from 14 to 21 days for anybody who's been admitted to the ICU to be transferred out to the regular ward and considered recovered. So we're probably seeing still the residual of the cases who turned positive and got really sick, no, in the past 2 weeks are still being admitted to the ICU, accounting for this kind of occupancy. So after looking at where we are now, the question we want to answer is, how did we get here in the first place? Why was there such a huge number of cases over such a short period of time? It's important to understand transmission dynamics of this virus, because regardless of the variant that is going around, the virus still follows these patterns in general. An infected individual is expected to generate different sizes of particles that are laden with virus. They may be larger particles called droplets, which because of their weight and size cannot travel very far. The typical distance is 1 to 2 meters. And anybody who is a source who's not using barrier protection like a mask or shield, or who is facing somebody without a mask and shield, can definitely infect and transmit these particles very readily. Now, these large particles, as I mentioned, are quite heavy and can only travel a short distance and typically fall onto surfaces very easily. And so that will account now for the spread of the virus via surfaces and objects. Another more recently recognized portal for transport or for transmission is these smaller particles that we call aerosols. And because they're smaller in size, they're lighter in weight, they're capable of traveling over long distances. This is what we call airborne transmission. So of the three modes of transmission, droplets and aerosols are still considered to be the most efficient. And we hardly hear of fomites or surfaces or objects being responsible for transmission of these viruses, because for objects to be responsible for transmission, first you have to have a significant amount of the virus, and they should remain viable over a period of time. And typically, viruses don't really live very long when they're on inanimate surfaces or once they exit from the body of the source case. Now, understanding those portals or methods of transmission will help us also understand the way the currently circulating variant is behaving. In many countries, Delta variant has been identified as the predominant circulating strain. And Delta has been identified as being more highly contagious, and in fact is more than twice as contagious as the previous variants. The original COVID-19 virus was known to have a reproduction number of 2 to 2.5, meaning every infected individual could be expected to infect about 2 people that were exposed, no, to the original, to the infected person. However, Delta variant typically exists in a person in much higher numbers. It's said that an individual who is infected with Delta will probably have 1,000 more in terms of viral load compared to somebody who was infected with the previous strains. And so because you have more of the virus, it's easier to share more of what you have. And those people who were infected with Delta variant are expected to infect anywhere from 5 to 8 individuals moving forward. So it's much more highly contagious compared to the original circulating strains. One observation has also been that Delta seems to have been associated with higher numbers of admissions to hospitals, ICUs, and have been responsible for more deaths. And although it's tempting to automatically conclude that that might be because the strain is more virulent, more capable of causing severe disease, we also have to think about the possibility that this would be happening because you're infecting more people. Because you're infecting more people, naturally this will include people who are in the older age range or those who are having severe underlying illness. And so it could be because you're getting more of that kind of population, then naturally you would expect their outcomes to be poorer. But in any case, no, the bottom line is that because more people are infected, more people are being admitted to the hospitals and in the ICUs, then the healthcare system needs to be ready to respond to this particular challenge. I mentioned earlier that the Delta variant is much more contagious compared to the original strain. And this infectiousness has a significant impact on what is called the herd immunity threshold. Herd immunity is the proportion or the threshold, the herd immunity threshold is the proportion of people in the community that you will need to have already protected so that you stop transmission to other unprotected members of the community. So how do you achieve that protection? Typically, you want to vaccinate people so that they're no longer capable of transmitting disease. So for the original COVID-19 strains with a reproduction number of 2 to 3, the herd immunity threshold was computed at about 70%. If you still remember the Alpha variant or the one that was first observed or detected in the United Kingdom in December of 2020, that particular variant had a reproduction number of 4. And plugging that into the computations, the herd immunity threshold for that variant was a little higher at 75%. For Delta, with a reproduction number of 5 to 8 and just using 6 as a median number, the herd immunity threshold now rises to almost 90%. And this is quite again, another challenge for the public health system because this will mean that more effort will be needed to be able to address the concern of transmission. So let me go to the last question that might be of a more practical nature. How do we move forward? When the pandemic started, a lot of hope was pinned on formulation of vaccines because for many infectious diseases, vaccines have really proven a very efficient and effective way of addressing diseases like measles, chickenpox, flu, polio, all of which are now controlled because many individuals of many communities have already received vaccines against these diseases. Vaccines are generally just a way for the immune system to learn how to protect itself against viruses and bacteria. And the SARS-CoV-2 virus um, is actually an example, no, of a antigen that the body can learn to recognize if it is trained by previous exposure. So usually, no, through vaccines. So when our body is exposed to a formulation that contains the parts of the virus that it can recognize, then our immune system is capable of producing antibodies, which you can think about as bullets. And our immune system also trains its soldiers, no, or the cellular immunity, so that together, whenever our body encounters the actual pathogen or the actual virus, then it is ready immediately to be able to protect our system against disease. Now, because COVID has been such a significant problem, developments, no, in vaccine formulation have really been fast-tracked. And what we see are a huge number of platforms that are available, no, for public use. What we have right now are mainly classified as inactivated vaccines, such as Sinovac or Sinopharm. We also have our mRNA vaccines, examples of which are the Pfizer and Moderna vaccines. And we also have our non-replicating viral vector vaccines, under which the AstraZeneca and the Janssen vaccines belong. So many other vaccine platforms are also being developed now. You may have heard of the Pneumonia vaccine, which is hopefully going to be available still within the year. And there's still many other vaccine platforms that are being utilized and being developed. Now, has the expectation of the impact of vaccines been realistic? We see here the graphs representing the number of cases and deaths among countries that have had lower rates of coverage. So the range here is anywhere from 1% all the way up to about 13%. And we will see that the number of cases represented by the blue parts of the graph are mirrored by the number of deaths, which are here reflected in the red parts of the graph. So the proportion of people that we expect to be infected will roughly be equivalent to the number of people who will eventually die of the disease. Now, in countries where vaccination has really progressed and covered a significant proportion of their population, what has happened? In this part of the graph, we will see the examples of the UK and Portugal. At this time, when this graph was generated, the UK had covered about 50% of its population, and Portugal had covered about 43%. Now, you will see that in the past, of course, they had a lot of cases prior to the vaccination period. And in UK, for example, by July, they had already vaccinated most of their vulnerable population. So even if cases continued to be reported, first, they were significantly lower than during the pre-vaccination period. And you can hardly see the red parts of the graph, meaning even if they had cases being reported, deaths were very few compared to the number of cases. And this is really what we want to achieve. It may not be possible at this point for vaccines to fully protect us in terms of infection. But so long as we don't get severe disease and we don't die of COVID, then that can be a very valuable first step, because that now allows our healthcare capacity to be preserved and to be able to cope with those people who really need healthcare for other diseases, and also for severe COVID because either they haven't been vaccinated or because they really are in a poorer state of health and therefore still unable to totally um, um, be protected even if they're vaccinated. So aside from vaccination, is there anything else we can do? We started off with the pandemic response by focusing on interventions such as wearing of masks and shields, physical distancing, watching out for our times of interaction, because understanding the way the virus was transmitted, this was going to be some of the more effective ways, or at least some of the ways by which we could avoid being infected. But if we look at this hierarchy of controls, we will see that those interventions are actually classified as among the least effective. Because you think about it, this is very dependent on human behavior. If the person wears the mask and shield in the wrong way, or is not able to distance because of limitations of space, like for example, if you're taking public transport to commute, then you really don't have a lot of choice. Or perhaps you're in a workplace that requires you to be on site because perhaps you're in manufacturing, then you cannot control your time of interaction. Then the effectivity of these interventions is really going to be quite limited. What we want really to move towards are those interventions that are more independent of behavior and that are going to be implemented or put in place via a system that doesn't even require us to think twice by replacing the hazard or isolating people. But what you really want to do is to physically remove the hazard if it's at all possible. And those are the ways by which vaccination and ventilation are utilized. So I talked a little bit about vaccination already. Let me move towards ventilation so we understand how we can utilize this strategy. You want to actually be able to take advantage of fresh air, flowing air, and finally filtered air whenever it's possible. Fresh air is intended to bring the outdoors into your workplace or buildings as a new source of clean air, while flowing air is intended to maximize the circulation of air throughout an indoor environment. If fresh or flowing air are not available, then that is when we utilize filtered air, which focuses on removal of contaminants from the indoor air space. How do you get fresh air? Of course, we open our windows and doors, and if it's not entirely possible to keep them open, then even a gap of just 6 inches is going to help a lot with it. Your goal is to increase the volume of air exchanges per minute. In the hospitals, the target is really 6 to 12 air exchanges. And it's possible to calculate this for your buildings and homes, but more practical way is really just to use a CO2 monitor. These are widely available on online portals. And the goal is actually to use your carbon dioxide as a marker. We know that people exhale carbon dioxide, and if your circulation is stagnant, then the carbon dioxide is going to stay within that space. Now, if you can demonstrate that your carbon dioxide levels are low, then that can only mean two things. You don't have any people in the room, or your air is constantly being replaced such that your carbon dioxide concentration is very low. The aim is to get a reading of 800 or less to be able to demonstrate good air quality. Flowing air is also something that we need to take advantage of. And aside from utilizing your windows and doors to encourage airflow, you can also utilize fans or exhaust fans and electric fans that will be able to move the air around. So the CDC has these specific instructions about fans. You want to place a fan as close as possible to an open window and blow it outside, because if you point the fan towards a person, then you can actually be facilitating the infection. So you want to point away from the person and towards an outdoor space. You also want to be able to move, or rather open a ceiling fan if that's available, to get air to circulate. Finally, filtered air can be utilized in closed environments. This is actually the setting where HEPA filters are most effective. And we just have to understand that not all devices are made for the same setup. You actually want to be able to make sure that your clean air delivery rate of at least 300 per 500 square feet of space is complied with. So if you are opting to buy these HEPA filters or MERV 13 filters, then you want to make sure that they're appropriate for the size and occupancy of the space that you're planning to sit in. So these are examples of what happens when you have poor ventilation versus good ventilation. If you imagine the particles as the aerosols that I explained earlier, of course, when you have closed windows and doors, then they can stay in the air for quite some time. And when you have open windows, doors, an exhaust fan, a ceiling fan, then it's very easy to dissipate these particles and to decrease the chances of getting infected. So let me just share a few more tips before we end this discussion. I think one of the things that people need to understand is it's entirely possible to plan before COVID even affects our homes and workplaces. And by planning, this allows us to be able to manage our anxiety, no? Because we know we're ready whenever there might be a crisis. So these are some things that we need to evaluate. First, are the household or workplace members able to ensure strict compliance with the minimum public health standards whenever they leave their bubbles? Particularly for households, people who are working or do the essential errands are responsible for making sure that they are safe so that they don't bring the virus home as pasalubong for their families. And the items that I mentioned already earlier, like making sure you're in a place where the circulation is good, or you're able to physical distance properly, or you can manage your time of interaction. These are all things that we can actually plan ahead. No? So when we travel, we want to be able to make sure that we're not traveling at peak time. So hindi marami ang kasama natin sa sasakyan. Or hindi tayo nagtatagal sa traffic kasi maraming nasa labas. Pwede ba nating ayusin yung ating workplace para hindi na tayo nilalapitan ng ating mga kausap or naka-distance yung mga working areas, or pinaplano natin yung ating mga meetings. Karamihan sana online, at kung kailangan ng face-to-face, ang agenda manageable para sandali lang tayo nagkaharap-harap. Kung nagsusuot tayo ng mask and shield, dapat consistent at tama ang paggamit. Also, we have to realize that one of the ways by which disease is usually transferred in clusters outside the home is because people take off their mask and shield when they eat. So bawal na talagang magsalo-salong kumain. Pwedeng magsabay, wag lang magsasalo. You can take advantage of each other's company. Pwedeng hindi kayo sabay na kumakain. Yung isa nakamask muna, kakain yung isa, and then the other person, you can take turns. But really the best thing to do is not even to eat together, because when you review the history of people who have been a part of workplace clusters, this is really the key thing that's identified. They ate together and then suddenly everybody's sick. We want to limit times of interaction, as I mentioned, but we want to take advantage of virtual meetings when possible. And if face-to-face meetings are necessary, then we want to be able to be efficient in those meetings. So there are other questions that you might want to also set up and ask about. You also want to be able to figure out, is there a testing facility that's near your home, so that if you need to be tested, hindi ka lang dun pa lang naghahanap. No? Alam mo na kung saan ka pupunta, kung magkano inaabot nun, or meron bang libre malapit, gaano ka kabilis bago makuha yung resulta. Kasi very critical din na anybody who feels sick should isolate right away. Wag nang pakiramdaman yung simptomas. Kasi kung pinapakiramdaman pa natin and we continue to interact with other people in our homes or workplaces, at kung nagkataon na nag-test positive ka, lahat ng yon, ipo-contact trace mo at sasabihin mo, I'm so sorry na expose kita, kailangan nyo ng pang-quarantine. So the value of decreasing the time from onset of symptoms to the time of diagnosis is really because we prevent exposing other people in our surroundings. So kailangan natin malaman kung saan pwede magpa-test para magawa natin. Pwede rin natin alamin sa ating area or community kung papasa ba ang ating home setup for home quarantine. I'm sure that's also a source of anxiety for a lot of people. Siyempre, ayaw nila mag-quarantine sa mga isolation facilities or TTMFs. So, hindi ba natin pwedeng kausapin na yung DHERD sa ating lugar o yung ating barangay captain? Pwede natin ipakikakap kung dito po ako magpo-quarantine, papayagan mo ba ako papasabayan sa'yo? And sana kung kunwari sasabihin niya, kailangan mo ng ganito or kailangan ng ganyan, you can set up that up ahead of time. So that if anybody's positive, then you already know how you're moving forward. Finally, kung nagkaroon talaga ng pagkakataon na meron ng may sakit at kailangan ng ma-ospital, alam pa natin kung saan tayo pupunta, saan ang pinakamalapit? Or meron ba tayong makakausap na telemedicine provider to guide us through the home care that we might want to explore if appropriate for our household member? Pwede natin i-set up yan ahead of time para hindi tayo naghahagilap kung kailangan na at syempre nakakataranta na pagka ganoon ang sitwasyon. Finally, as I mentioned, vaccines are really a game changer for us at this time. Bago nung taon na ito, ang problema talaga natin is wala kang masyadong maasahan para maproteksyon na ng sarili mo against disease. Kung hindi yung apat dapat, nakatulong naman yon kahit papano. Pero dahil meron na tayo nitong bakuna, mas malaking impact, mas malaking protection ang kaya natin asahan. Vaccines continue to be highly effective against severe illness and death, even from the Delta variants. And so I think we really should take advantage of this, especially if we're already qualified to receive our vaccines. So let me conclude by going through the questions once again. Where are we now? Some control is now being achieved, pero huwag tayo magpakakampante. Ilang beses na natin nakita nung matapos ang mga surge, nag-open up ang ating community quarantines na sumusunod na naman in 2 weeks time ang pagtaas ng kaso. So, kailangan pa rin dapat maging maingat. Tapos, how did we get here? Magaling yung virus Maghahanap at maghahanap ng butas, maghahanap at maghahanap ng pwede niyang paghawaan. So, dapat mas mautak tayo kaysa sa virus na to. Dapat alam na natin kung paano siya kumilos para makaiwas tayo ng maigi. Finally, how do we move forward? We need to be able to think through how this virus gets transmitted. We understand our enemy and work smart to be able to protect ourselves and our families. So with that, let me end this presentation. Thank you for your attention and turn the floor back to our moderator for your questions.
All right, thank you, Dr. Ong Lim, for providing us a huge update on especially where we are now on the fight against COVID-19. And actually, my key takeaway is that I don't have to be complacent. So it's best always to do the safety measures you have provided to us. Thank you very much for that. And now we are activating the live Q&A chat box to accommodate your questions for our guest speaker. Please write down your questions in the Q&A box found at the bottom part of your screen. All right, so we will now entertain your questions, guys. Feel free to give us a chat. All right, first question is from an anonymous attendee. Doctor, how accurate is the data being released in the news regarding the number of cases daily when in fact some laboratories fail to submit their reports on time? Thank you very much, Mr. Anonymous attendee. Doctora, can you answer this?
Well, of course, we know that the laboratory submissions will impact on the number of cases being recorded. And as I mentioned, hindi nga lang yung laboratory submissions, problema din yung behavior ng mga tao with respect to testing. Pero siguro, kung hindi naman natin binubusisi kung 100 or 101 yung kaso, di ba? Wala namang masyadong difference yun. We're really more interested in trends rather than the specific numbers. And I'm sure nakikita rin naman ng lahat, no, that currently, the trends are going down significantly. Ako, alam mo, ang pinakasimpleng test sa akin ganito eh. May masasabi ka bang kakilala mo, kaibigan mo na may sakit ngayon? Parang wala, di ba? Pero nung kasagsagan ng surge, kulang pa siguro yung 10 daliri mo para sabihin mo yung kakilala mo. So yun talaga. Sa bawat surge, mapapansin mo yan. It's being able to name people close to you na nakakasakit. Ay nako, matakot ka na. Mauna pa yun kaysa dun sa pagdami ng numbers. Kasi clustering talaga ang key dun sa pagdami ng kaso. Kasi biglang isang household, kung 6 yung tao nyo, biglang 6 yung madadagdag dun sa numbers. Ganun na nakikita natin behavior pag-search. Kung hindi yan workplace, household.
Alright, so it's like a key indicator. So you don't have to go too far, no? So even our close relatives can actually tell us if it's search.
Yeah. Ako, mag-ingat ka na, susunod na yan talaga. Dadami
oh my God. And I hope it won't happen anytime soon. Yeah. Thank you very much, Doctora, for that. Next question, also from an anonymous attendee. What are the recommended booster vaccines for the initial COVID-19 administered? Examples are Sinovac, AstraZeneca, Moderna, and etc.
Nabanggit mo kanina, Katie, sa introduction mo yung HTAC recommendations. So siguro I'll clarify that. Unang-una, intindihin muna natin yung concept ng boosters. Iniisip ng mga tao na kailangan na natin ng additional doses ngayon kasi napapabalita na parang bumababa yung antibody levels based on some scientific reports. No? So, unang-una, hindi lang naman antibodies ang inaasahan natin para magkaroon tayo ng protection. You consider your antibodies like bullets. And the soldiers that will use those bullets, your cellular immunity, that's not readily measured. So even if you have 100 bullets, if your soldiers are a lot, kahit wala siyang bala, kaya naman niya suntukin yung kalaban, di ba? So pwede pa rin.
Exactly.
Okay. So hindi lang tayo umaasa sa antibodies para maproteksyonan yung katawan natin. Pangalawa, hindi naman natin alam kung ilang bullets ang kailangan natin. Kahit may 100 ka, kung isa lang pwede na, sulit pa rin, okay pa rin yung 100 mo. Kahit 50 pa siya, meron ka pa rin isa na panlaban. So yun yung tinatawag na correlate of protection. We don't know that yet. That's not yet something that is defined. No? And it's not just a Philippine situation, that's a global issue. We don't have the correlate of protection that will tell us that this is the minimum number that you will need to be able to be protected. So, kung hindi pa natin yun alam, bakit nag-booster na yung bansa? Diba? Pansinin natin, hindi yan general recommendation ng lahat ng bansa. And that's a little controversial. Pansinin din natin, si WHO SAGE, which we look up to as the authority for these recommendations, has held off their recommendations kasi sobrang controversial tong topic na to. No? So, inaabangan pa natin their timeline is within November, maglalabas sila ng report. So that only tells you that the science is really rapidly evolving and it's actually quite controversial. Siguro ang merong agreement lang sa ngayon is that yung immunocompromised, no, yung mahihina yung immune system, hindi nila actually kailangan ng booster, ang kailangan nila third dose. So parang ang tanong, ano na naman yan? Diba? Ang hepatitis B vaccine, ilang bang bakuna tinatanggap natin? Di ba 3? So, for people who have immunocompromising conditions, hindi kaya kulang talaga ang 2 sa kanila. Kailangan nila ng 3 para mabuo yung protection. So, even that is still being debated. But in any case, no, ang medyo may consensus ngayon is if you're immunocompromised, you probably need a 3rd dose. Doon tayo muna mag-focus. Kasi yung mga yun, talagang may demonstration na kailangan nila for additional protection, for full protection. Now, yung everybody else na normal naman ng pangangatawan, yun, medyo pinagdedebatihan pa yan ng gusto. Even in the US, where they decided to roll out their boosters, their scientists are not uniformly convinced that normal individuals should actually be boosted. Ang pinatarget lang talaga nila ay may konsensus sa kanila is yung elderly saka yung immunocompromised. So ano mangyayari sa atin? So yung lumabas na HTAC recommendations, isa lang yon sa mga inputs na gagamitin ng Department of Health sa decision making. Hindi pa yon ang recommendation. So pinag-aaralan pa hanggang ngayon. Malamang magiging focus talaga will be immunocompromised and healthcare workers kasi na constantly exposed. Ang naging focus ngayon, particularly for NCRs, instead of debating the issue of boosters, na sa ngayon ay binubuo pa lang yung information, why don't we try to improve community protection by targeting another risk group, which is our 12 to 17. So yun ang niro-roll out ngayon kasi mas may science to support.
All right, thank you, Dr. So I believe that's something to watch out for, no? So in the coming months, I hope. Thank you very much for that. Now, let's move forward to our third question. So alert levels are downgraded, borders are opening. What would be your best advice to prevent another surge of cases?
So, namamanage talaga ang increase in cases through several means. No? Unang-una, compliance with minimum public health standards. So, yung concept of being able to manage physical distancing, exposure to closed settings, and being protected from those exposures by the correct use of our mask and shields, hindi natin matatawaran yan. Kasi nung bago dumating ang bakuna, yun lang naman ang ating inaasahan, di ba? And I believe karamihan naman sa atin na kinabang sa ganyan at hindi naman tayo nahawaan. In fact, yung mga nagtatrabaho sa ospital, ano ba inasahan namin bago dumating yung bakuna? Diba yun lang naman, naka-PPE lang kami, tapos inaasikaso yung distancing and so on. So they're still quite effective. Now, kung sobrang bilis ang pagdami ng kaso, wala na naman tayong choice kung hindi mag-quarantine ulit. Diba? Kasi ang purpose ng quarantine is really para pigilin yung pagbilis ng pagdami ng kaso. Kasi kung masyadong mabilis ang pagdami ng kaso, walang pupuntahan sa ospital, makamatay ang tao kasi di sila makakakuha ng tamang care. So, ayaw na sana natin ng ganun. Kasi nakita natin yung impact ng quarantines. Masyado siyang, how would you put this? Devastating talaga, di ba?
Yes.
On a personal and a general level. Nung simula, medyo kinaya-kaya pa natin kasi syempre medyo mataas-taas pa yung pondo ng pasensya Kaya pa natin. Pero ngayon, habang humahaba, yung resilience talaga naapektuhan.
Yes.
And of course, yung actual resources natin naapektuhan din. So parang hindi na, lalo nagiging option yung quarantine ulit. So kung ayaw na natin ng quarantine, anong gagawin natin? Dapat lahat ng iba pang mga interventions i-maximize, lalo yung bakuna. Kaya dun tayo nakafocus ngayon.
All right, thank you, Dr. So I think we just have to be more serious about those things that you were mentioned, like for the face mask and the face shield. So those things, kasi it's everyday na ginagawa, sometimes you have to take for granted. But actually, this is something that we have to be serious of as we battle COVID-19. Thank you very much. Next question, is there a specific vaccine recommended for minor ages, 12 to 17 years old? Dr.
There's actually only 2 vaccines that have global emergency use authorizations for 12 to 17-year-olds. And these are the Pfizer and Moderna vaccines. So in the rollout, in our country's rollout, since Moderna supplies are so erratic, ang magiging available lang sa public program natin is the Pfizer vaccine.
All right, guys, you heard Dr. It's actually Pfizer for ages 12 to 17. Thank you, Doc. Next one, hi, Doc. Is it safe?
Let me also.
Go ahead.
Kasi may natanggap lang din akong message ngayon Medyo sisentimiento tong kausap ko kasi sabi niya, parang magba-birthday na yung kanyang anak at hindi pinayagan. No? Hindi pa kasi 12. So siguro kung nandun kayo sa ganung situation, please be aware. No? We're very strict about the age limit. Kasi yung problem is the below 12 use a different formulation. Hindi to yung pagiging nitpicky. It's a different formulation for the under 12s. Kaya hindi sila pwedeng tumanggap unless they're at least 12 years old. Lower dose, lower concentration ang tinatanggap ng younger age group.
All right, thank you, Doctor. At least we understand that concept.
Yeah.
All right. Next question. Hi, Doc. Is it safe to have my pneumonia shot and flu shot just after my second dose of COVID vaccination?
Sorry, again.
Is it safe to have my pneumonia shot and flu shot just after the second dose of COVID vaccination?
The recommendation is to wait 2 weeks between receipt of any vaccine and a COVID-19 vaccine. So let me just explain kasi there are some people who may be reading from online resources that in other countries they give it at the same time. There's no issue. Actually, tama naman yun. These are all inactivated vaccines. They're not expected to impact each other in terms of safety or efficacy. Pwedeng pagsabayin yun in one visit. Ang diferensya lang kasi sa atin, we just want to be very careful about observing any after effects from vaccination. So it just makes it simpler. Kapag ito yung natanggap mo, alam mo yung binabantayan mo, kung may relationship man sa bakuna, ay dahil lang dito. Eh kung dalawa yun, hindi mo alam saan ba siya nanggaling.
All right.
Nakalito.
All right, so you have to be worried on that, guys. Thank you, Doc. Next question. Are there any studies done for COVID-19 vaccines for children 11 and below?
Meron, no? May mga studies. In fact, sa US, I think last week, nalabas na yung emergency use authorization again ng Pfizer for 5 to 11 years old. So, we're hoping na sana magkaroon din tayo ng similar EUA. Pero as I mentioned, iba kasi yung formulation niya. Kaya, we have to expect another set of products to be transported.
All right, that's something to watch out for as well. Thank you, Doc. And this is from our Dr. Welcomia here at Generali. Doctor, do you see as a possibility, given that the COVID-19 virus mutates and generates new variants, and given the variant protection that current COVID-19 vaccines provide to vaccinated individuals, and given breakthrough infections, that vaccinations will have to be carried out yearly, if not more frequently, especially to enter the certain segments of the populations, like for example, frontliners, healthcare workers, or elderly people, etc. Similar somehow to how elderly people may need to be vaccinated against flu and pneumonia, flu vaccine and pneumovax respectively. Or will the herd immunity be the solution, quote unquote, assuming the Philippines get to that point soon enough, hopefully?
Alam niyo itong virus na to is really very tricky, di ba? Parang pansinin niyo every time na parang feeling mo makakahinga ka na, biglang may lumilitaw na
another one comes along.
I remember this exact feeling nung bago mag-July. Katatapos-tapos lang nung March surge natin. Typically takes us about 3 months to recover. So March, April, May. Parang feeling mo, okay, baba na tayo, okay na ulit. Tapos biglang paakyat na naman yung numbers ng July. Tapos boom, ayan na siya. So ito na naman tayo. Nako. Tapos ano ba narinig natin? Yung panibagong Delta subvariant. Diba? Parang nagbabadya na naman siya. So, ang hirap magsalita ng patapos talaga against this virus. We're hopeful no, this time around kasi ang meron natin ngayon na wala dati yung vaccine. So, entirely possible na kailangan natin magkaroon ng additional doses at some point na dapat siguro regular na magkaroon ng repeat doses. It's very hard to say. Pero usually the goal for these types of vaccine-preventable diseases is to find a conserved region of the virus particle or the bacterial particle against which pwede mong targetin yung vaccine formulation mo. So that kahit magbago pa yung ibang parts niya, yun hindi nagbabago at parating epektibo yung bakuna. So hindi pa tayo nakakarating doon even for the flu vaccine sa ang tagal-tagal na natin ginagamit in medicine, di ba? So siguro matagal pa bago natin marating yun for COVID. Pero The difference is we're now in the place where scientific development was really tremendously fast-tracked. So hopefully, that can help us discover a more efficient second and third generation vaccines that might provide longer protection. But I agree, posible na kailanganing mag-repeat doses.
All right. So hopefully we can keep up with how unpredictable COVID-19 is, Doctor. Thank you very much. Next one, if a vaccinated person isn't able to get a booster, will he return to his immunity state of unvaccinated?
Hindi naman. In fact, di ba nga yung question is, kailangan ba natin ng boosters in the first place? Hindi pa nga yan nasasagot. So, kung hindi naman pala natin kailangan ng boosters, pwede pala natin asahan yung protection that we have right now. So, what you expect is that once your system has been primed or a little trained, so to speak, to recognize this virus, meron siyang kakayahang lumaban. Pero yung visa ng paglaban niya, yung vaccine efficacy na tinatawag, yun yung nagbabar. Pwedeng mababa na yung vaccine efficacy at some point. At para kailangan natin, or para makinabang tayo dun sa protection, uulitin natin or dadagdagan natin yung doses. So, we don't expect to be zero, but you don't want to be so low that it's halos no benefit.
All right. Thank you very much, Doctora. Now, I believe you have a new variant for COVID, and it's actually new to me. Doctora, can you tell us about the MU variant?
Siguro let me talk about variants in general. No? Ang virus, dahil napakabilis niya mag-replicate, very prone talaga to errors in reproducing its genetic code. Para yung kumokopya ka ng notes, pag nagmamadali ka, marami kang errors. So ganun si virus, ang bilis-bilis kasi niya mag-reproduce, maraming errors in reproducing its genetic code. Kaya mayat-maya talaga nagkakaroon siya ng variants. Napakaraming variants. Hindi lang itong mga naririnig natin sa Greek alphabet, ang dami pang sub-variants, yung mga na pakilala na sa atin. And this is really what you would say par for the course. So it's expected behavior for viruses. Karamihan dito sa mga to, they don't even make it to the watch list, what you call your variants of interest. Kasi naglalaho ka agad. Minsan lang sila madetect maya-maya, iba na naman ulit. At hindi naman sila nagpapakarami. So, lumilitaw lang sila as variants of interest pag medyo nagpapakitang gilas na dumadami, napapansin mo siya na siya nagpo-cause ng clusters in certain areas or in certain countries or in small communities. Now, kung mas marami na siyang nasasakop, yun na yung variants of concern. So far, 4. Si Alpha, Beta, Gamma, Delta. No? So yung mga yun, talagang kumalat yan sa iba't ibang bansa. Each one, probably you can see that is 120 different countries. So, etong 4 pa lang so far ang natatawag nating variants of concern. All these others that are being named are still just termed variants of interest. At yung mga variants of interest, pwede yung ma-demote. So tulad na lang ng P3, di ba? Yung unang natuklasan sa the Visayas region, dati variant of interest yan, ngayon wala na siya. Hindi na siya kasama dun sa VOIs. So, pwede siyang balitaan, typically na-observe, pero not necessarily always very concerned.
All right, that's a bit frightening since we now know that there are different variants other than the ones that are named, right? Thank you very much for that, Doc. Now, moving forward, what advice can you give to those who are still not willing to get vaccinated? Actually, that's I'm one of those. All right, Doctora, go ahead.
Alam mo, medyo natatagalan akong sumagot kasi...
You can take your time, Doc.
Hindi ganito. Parang ang gusto kong sabihin, ano pag inaantay mo? And that's the mildest thing I can say.
Right.
Pero kasi sobra akong, alam mo, pag naiisip ko kasi yung mga taong kakilala ko na namatay, hindi inabot yung bakuna. Yun na lang di ba? Parang nangihinayang ako for them. Hindi nila nadatnan ko. Hindi naman nila kasalanan na una silang na-expose. Pero unfortunately, it happened at a time where vaccines were not yet available. So if they had the vaccines, I'm sure they would have had a better fighting chance. So I guess in the end, hindi mo naman pwedeng pilitin yung ayaw magpabakuna. Ano ba naman ang magagawa natin? Pero siguro, malaman din natin kung bakit ba umaayaw, di ba? Ano bang concern ng taong hindi pa nagpapabakuna para kung kaya ma-address, edi sagutin natin. Yun lang naman. Kung safety ang issue, ilan na bang doses na distributed globally? 30 plus billion, parang last count. So, wala pa namang nagiging zombie. Okay pa naman tayo, di ba? Kung efficacy ang problema, well, wala naman tayong masasabing, sinasabi lang naman natin that vaccines are an additional layer of protection. So, bakit mo naman aayawan kung meron kang pang-limang layer, alam mo nga yung 4, pwede kang malusutan. Kahit nga 5, pwede ka pang malusutan. Sulitin mo na, di ba, yung kaya mong ma-access.
All right. Thank you, Doc. Perhaps that's something we can consider moving forward. Now, moving on to our next question. People who feel symptoms who wants to be tested are discouraged to get checked because of the cost of RT-PCR tests. We only do so as requirement for travel or when we are in close contact with symptomatic patients. It is not cost-friendly for us to voluntarily be tested. What is preventing us from lowering costs for RT-PCR tests?
Actually, meron ng price cap na in-impose ang government authorities. No? Ang alam ko parang hindi na yata, meron silang 2 tier. Yung home service costing is slightly higher than the in-facility testing. But I think this has already been capped, recognizing that price can be a barrier for testing. Pero siguro I'd also like to inform our listeners na may mga facilities na very affordable ang testing, under 1,000 pesos. And in fact, may mga LGUs na libre ang testing. So kaya nga nabanggit ko kanina dun sa sa portion ng plan ahead, no? Maganda na bago pa tayo magkasakit, alam na natin kung saan tayo pwede magpa-test na mas abot kaya or even libre para kung kailangan na natin, di pa lang tayo doon naghahabilan.
All right. Thank you very much, Doc. Okay, so there are people offering Moderna vaccines, especially for those who were vaccinated with Sinovac, since it's been 6 months since the second shot. So, is it safe to get the Moderna?
So, babalik ko ulit sa nabanggit ko kanina, di ba, na wala pa tayong recommendation kung kailangan nga ba talaga ng additional doses. At hindi pa rin natin alam kung ano pa yung pinakamaayos na platform kung kailangan mong makatanggap ng additional doses. There's very intense debate about homologous versus heterologous platforms, crossing platforms, depending on what you receive. No? So since all of these are still unknown, I think kung wala namang very urgent need, no, na makatanggap ka na ng 3rd dose, I think ito yung appropriate na mag-wait and see ka. So, can you imagine, di ba? Parang when earlier, yung tanong mo kanina, yung mga hindi pa nagpapabakuna, yun, I encourage, bakuna na kayo. Pero I'm the same person telling you, yung booster sandali lang. Di ba? May mga yan, may mga evidences naman yan para mapagbasihan natin ng magandang rekomendasyon. No? Or mga anxiety reactions that required hospital stay para ma-manage lang ng maayos. Now, globally, napansin na may small proportion of individuals na post-vaccination nagkaroon ng tinatawag na myocarditis o yung inflammation of the heart. But the proportion of that group of individuals, once again, was so tiny na kung ikukumpara mo dun sa risk ng developing disease, sulit pa rin na mabigyan ng proteksyon ang karamihan ng mga bata. So, what do we expect to see in that particular situation? Yung kanilang mga symptoms include faster heart rate, a little difficulty in breathing, na after na-identify as being related to myocarditis, nag-resolve din naman after rest, no? No specific medications were required. So with that, ang realization is that protection is more beneficial versus the risk. So I'm showing this slide so that people can understand the numbers better. So typically males 12 to 17 ang affected, and ito yung mga numbers of cases per million. So about 60 cases per million second doses. So napakaliit. And yun nga, ang precaution natin dito is post-vaccination, ina-advise mo na wala mo ng shadow exertion para wala ng confusion. And ang trade-off nito, yung prevention ng admissions and deaths that we might observe in this age group that can be prevented.
All right. Thank you, Doc. So I think myocarditis is something that we can move forward naman if ever, no? So that we don't have to be frightened anymore from that. All right, next.
Very rare. Actually, I guess
very rare, yeah.
Super rare na parang unlikely na mangyari naman yan sa maraming tao. And if you're able to monitor, be watchful about it, then the earliest signs that it could possibly be seen, you bring it to your doctor's attention para ma-advisean kayo na kung anong gagawin, which is rest. Yun lang.
Alright. At least it's addressable naman po. Thank you very much for that assurance. Next one, it's actually from Bernard Agad. Are those having heart conditions still advisable to get COVID vaccine?
Yes, because they're actually identified as a risk group, no? So isa yan sa mga mga grupo ng mga may sakit na pagka nagkaroon ng COVID, talagang nadidisgrasya ng husto. Kaya dapat, no, if you have a heart condition, you really should be vaccinated.
All right, so it's a must really get vaccinated, Mr. Bonner. Thank you very much. Next one, how soon do you think our country will achieve herd immunity, given that there are sufficient vaccines already available? Vaccination rate still seems low.
I think, no, in as much as I mentioned that that herd immunity is the target, and that's been the target globally, it's a moving target. Every time you have a variant that comes up that becomes more contagious, then the numbers go up. So I don't think that our immediate goal should be to achieve herd immunity. Our immediate goal is to cover these people who are at the highest risk of getting into hospitals and ICUs if they get sick. So even if your overall goal is herd immunity, your immediate goal is to cover your A2 and A3. Kasi ano ba nakikita natin? Bakit ba tayo nasistress pag dumadami yung kaso? Hindi ba dahil pagka may nagkasakit at hindi mo maipasok sa hospital, problema ng pamilya, problema ng community, problema ng healthcare system. So ang gusto mo talagang i-address is hindi dapat mapuno ang ospital. So sino ba nagpupuno ng ospital? Hindi nga ba yung A2 at A3? So kung nabakunahan mo yung A2 at A3, mas mababa ang chance na mapuno yung mga ospital. Manageable yung mga kinakailangang dalhin sa ospital, whether it's for COVID or anybody else, di ba? So what you want is to saturate your A2 and A3 so that you can continue to move around in the community freely. Kung hindi natin yan ginawa, babalik lang din tayo sa ganitong sitwasyon in 2 weeks time.
That's one good reason to get vaccinated, actually, I think. Thank you very much for that. Next one, Doc, why is it that other countries like UAE allowed vaccination of children under 12 years? Sorry. Why is that other country like the UAE allowed vaccination of children under 12 years old?
Well, they might be allowing the use of other products, or they might have authorized the EUAs already for their 5 to 11. So that could be a reason. Siguro, yung sa atin naman, unang-una we take a fairly conservative approach. No? Pansinin niyo matagal-tagal na yung 12 to 17 na EUA. Last year pa actually yan sa US. Sa atin this year lang natin in-approve. No? So, meron naman tayong kanya-kanyang mga FDAs na tumitingin dun sa situation within the country. Tapos binabalansin natin yan with available vaccine doses para tignan natin kung sino dapat yung pinaprioritize. Siguro i-address ko lang, no, baka naman din pinagmumula nung nagtatanong nito, baka may anak siyang below 12. Bakit hindi na lang unahin yun? Willing naman sila magpabakuna. So magkagaling ulit dito yung sagot ko. Kahit bakunahan pa natin lahat ng below 18 na bata, tapos wala tayong binakunahang A2, yung elderly, hindi kaya mapupuno pa rin yung ospital natin? Siyempre sagot doon, yes, di ba?
Of course.
So hindi lang bakuna for the sake of vaccination yung ginagawa natin ngayon. Dapat mautak tayo. Paano natin pangunahan tong virus na to? Di ba dapat mag-strategize tayo? Sino ba dapat ang uunahin natin para hindi siya maunahan ng virus? So kaya parating inuuna yung A2, A3. At kaya inuuna yung E1 kasi pag wala kang healthcare worker, sinong gagamot sa mga tao?
Of course.
Diba? O yun, ganun tayo. You have to work smart.
So that's a more structured approach towards looking at who's the ones that's going to get the vaccine. Thank you very much, Doc, for that. Next one. Hi, Doc. Any thoughts on the announced COVID pill by Merck, which will apparently decrease probability of death for those who have contracted COVID?
So very encouraging yung news, no, ng molnupiravir. It's oral drug, so unang-una napaka-accessible, diba? Medyo pricey, but still, if you compare the hospitalization, still better. No? Siguro ang punto lang nito is it's given within a very specified window, no, ng patient characteristics. Dapat nando sa mild to moderate category, early in the game dapat. So this requires a certain kind of behavior from us para mapakinabangan natin itong gamot na to. Dapat nakakapagpa-test at may healthcare access ka para makuha itong mga gamot na to. Kasi kung wala ka na dun sa window na yon, kahit may pera kang pambayad, hindi ka na qualified. Nandun ka na sa moderate severe, di wala. So parang nandun pa rin dapat yung system to be able to identify the best candidates for this medication.
All right, thank you very much, Doc, for that. I think this is the last one. Is the COVID spray barrier nasal spray effective in preventing you to get COVID-19?
Actually, naglabas na ang FDA ng pronouncement dyan, no, na walang studies na pinapakita yung product na nakaka-prevent siya ng COVID. Siguro isipin na lang natin in practical terms. Para maging effective ang isang barrier spray, dapat nandoon siya dun sa hinaharangan niya for a significant length of time para mapigil niya yung pagpasok ng virus, di ba? So, medyo mahirap yan from a natural surface perspective kasi ang ating nasal linings, meron yung mucus, di ba? Parating namamasa-masa siya sa talagang natural behavior ng katawan natin to wash off these particles. So, kailangan maipakita na it can stay in place for a significant period of time for it to even consider being worthwhile.
That study has yet to be evaluated, right, for it to be said to be effective. Thank you very much, Doc. All right, so that's it for this afternoon. Thank you very much, Dr. Ana Onglin. We really appreciate all of these. Now, our fight against COVID-19 is far from being over. Our participants have definitely gained important information to continue in keeping everyone safe against COVID-19. We truly appreciate you, Dr. Ana, for taking some time and sharing your knowledge during this webinar. So there you have it, everyone. On behalf of Generali Life Assurance Philippines and Home Healthcare, Thank you for joining us today. We look forward to seeing you again for our next webinars. Once again, I am John Ketty. Stay safe and God bless.